everyone, welcome to another episode of the Anti-Pharmacist podcast. I hope you had a nice weekend, because I did, and it is because we are entering into a new season. I enjoy the cool environment, the cool weather and all of that, because I was honestly getting tired of that heat. It was too much, and I know that you felt the same way, except you are not in Nigeria, shall. If you are in another part of the world where it's cold, well, I know you can't relate, but for me, I am so loving this rainy season we're entering into, and I can't wait to have more and more rain. So I welcome you to another Monday, and on today's episode I'll be talking about infections. I've talked about a kind of infection in a previous episode, which are the sexually transmitted infection, but today I'm talking about a different kind of infection, and these ones are even more easily transmittable. Well, I'm talking about respiratory tract infections today. And coincidentally, today, March 24th, is World Tuberculosis Day. And I'll be talking about that too. Yes, so without further ado, let's get right into it. What are respiratory tract infections? Well, let's first backtrack and get what respiratory tract actually comprises of. The respiratory tract, also known as the respiratory system, is the biological system which is responsible for gaseous exchange, that is, taking in oxygen and breathing out carbon dioxide. Okay, it consists of your organs like your nose, your pharynx, which is your throat, your larynx, your voice box, your trachea, which is your windpipe, your bronchi. Okay, these are parts of your lungs, and your alveoli, okay, which is part of your lungs. See, the lung is the primary organ for gas exchange, where oxygen is absorbed into the bloodstream and carbon dioxide is expelled. But also your mouth is involved in all of this, because it is your mouth that leads to your throat and your voice box, right? It also leads to your lungs, your bronchi, your alveoli. It also is connected to your nose, so sometimes the mouth is classified as part of the respiratory system. Now, the respiratory tract is divided into the upper respiratory tract and your lower respiratory tract. Your upper respiratory tract consists majorly of your nose and mouth. Also, it includes your nasal cavity, your sinuses, that is the hollow areas in your cheeks, your forehead, and also your larynx, like I mentioned, which is your voice box. That is your upper respiratory tract. While the lower respiratory tract is your pharynx, your throat, and your lungs majorly. Okay, your bronchi is part of your lungs, so also your alveoli. Those are the upper and lower respiratory tract. So when we talk about infection of the respiratory tract, which are called the respiratory tract infection, that tells you that we have the upper respiratory tract infections and lower respiratory tract infections. But what I really want to talk to you about today are the causative organisms of this respiratory tract infections, the causes, the risk factors, the preventions, and the treatment considerations. Okay, respiratory tract infections are majorly caused by the microorganisms we have in our environment, the bacteria, the viruses, and some fungi as well. They are the causative organisms of respiratory tract infection. And you agree with me that these microorganisms are everywhere in the environment. Okay, they are everywhere. They are on surfaces, they are on some skins, they are in the air. So you really have to be very careful. Upper respiratory tract infection includes but are not limited to common cold, your sinusitis, tonsillitis, laryngitis. Okay, the itis are just inflammations. Okay, when we say tonsillitis, that's inflammation of the tonsils, pharyngitis, inflammation of the pharynx, laryngitis, inflammation of the larynx. Alright. While lower respiratory tract infections are the likes of bronchitis, bronchiolitis, your pneumonia, tuberculosis, COVID-19 can be upper or lower respiratory tract. Flu can be upper or lower respiratory tract infection. And the lower RTIs, they tend to last longer than the upper arteries. Maybe because they are more deep-seated. They are already inside the body. Do you understand? Yes. So I mentioned that these respiratory tract infections are caused by microorganisms in the environment, like bacteria, your viruses, your fungi, alright? So common viruses that cause respiratory tract infection include rhinoviruses, the one that causes common cold, influenza virus that causes the flu, there's respiratory syncytial virus, RSV, okay, there's adenovirus that causes bronchitis and cold, there is parainfluenza virus, there's human metapneumovirus, there's coronavirus, the one that caused COVID-19. The bacteria causes of respiratory tract infections are the likes of Streptococcus pneumonia, Haemophilus influenza, Mycoplasma pneumonia, Chlamydia pneumonia, Bordetella pertussis, the one that causes whooping cough. There's Streptococcus pyogenes, Rexella catarrhalis, okay. There's Klebsiella pneumonia that causes the common pneumonia that we know. There's Staphylococcus aureus, it also causes a type of pneumonia. We have Pseudomonas aeruginosa. All of these are bacteria that cause respiratory tract infection. Now to the fungal causes, there's Pneumocystis jirovecii. This is the one that causes pneumonia with people with weakened immune system, like in HIV and AIDS patients. There's Aspergillosis. It also causes a kind of pneumonia in people with weakened immune system. And there's the Candida. It also causes a type of pneumonia in people with weakened immune system. Other pathogens are Mycobacterium tuberculosis and Legionella pneumophila. Okay, it causes what is known as the Legionnaire's disease, which is a severe form of pneumonia. Like I said, I'll be talking about tuberculosis on the podcast. So it is one of the respiratory tract infections caused by this microorganism, particularly the bacteria called Mycobacterium tuberculosis. Now, apart from these microorganisms that cause these respiratory tract infections, there are other causes which we refer to as risk factors that could also predispose you to having this respiratory tract infection. Factors like smoking, lifestyle, when you are a smoker or you are exposed to smoke, or some substances from the environment like dust, chemicals, vapors and fumes, allergens and pollutants in the environment. It could also predispose you to having respiratory tract infection. Other risk factors for lower respiratory tract infections are recent cold or flu, a weakened immune system, age is also a factor. Children under 5 or people over 65, their immune systems are weaker, their organs are not as developed or are old now. Then those that have undergone surgery recently, those are factors that could predispose you to respiratory tract infections. Alright? Now, how are these respiratory tract infections even transmitted? They are transmitted via 3 major ways, okay? Number 1 is through the air, through sneezing or coughing or talking. When you talk and saliva comes out of your mouth and into the atmosphere. It is from this atmosphere that others inhale these microorganisms. So that is airborne, okay? Another way in which it can be transmitted is through contact. When you touch surfaces that contain these microorganisms, or you touch somebody else that has these microorganisms on their faces, on their arms, on their body, then you touch your nose, your throat, or your mouth. You can inhale them that way and take them in. And the third one is by sharing objects, majorly utensils, okay? You're sharing spoons, you're sharing forks, or even a cigarette. You can pass these things to your oropharyngeal cavity through that means. So those are the 3 major ways in which you can transmit these respiratory tract infections, which leads me to the prevention. Now you know the causes and how they can be transmitted. Automatically, you should know that the reverse is the case to prevent. When you have weakened immune system, try as much as possible to stay away from people that you are sure are infected, or even having contact with people indiscriminately, right? Try as much as possible to boost your immune system through exercise and proper nutrition, eating balanced diet, taking enough rest, not stressing yourself too much, right? Avoid unnecessary contact with surfaces, and if you touch surfaces, be sure to always wash your hands or sanitize your hand. I know that when COVID-19 was a thing, it's not like COVID-19 has left, guys. It is still very much around. It's just that the focus has shifted from it, and it is not considered as deadly as it was when it first arrived. Okay, it is still in the environment. It's very much around, because I know that some people have neglected hand washing since then. They have neglected using sanitizers or even nose mask. I know that it is not made compulsory anymore, but for your own health and for the health of people around you, when you know you have cold, you have the flu, you're sneezing, try as much as possible to reduce contact with people. Use your nose mask, okay? Use your nose mask. When you're coughing, cough into the crook of your hand. You know that your elbow joint, inside it, cough into it or sneeze into it, or take a cloth with you to cough or sneeze into. Don't just sneeze into the atmosphere for other people to absorb or contract the disease from you. Do you understand? Always maintain impeccable hygiene. As soon as you enter your house from wherever you have gone to, wash your hand with soap and running water. Also, disinfect surfaces regularly with antiseptics, okay, so that you can kill the germs on the surfaces, especially if you have immunocompromised people around you, young children, older people. You need to do this all the time. And the thing with respiratory tract infections is that the symptoms are most times self-diagnosable. You know when you have them. You may not know the particular one, but at least you know that, oh yes, I have a respiratory tract infection. And they are not far-fetched, okay? When you start coughing, you start sneezing, you start feeling stuffiness in your face, headache, loss of appetite, weight loss that is unexplainable, wheezing. These are signs that, oh, you have respiratory tract infection. You might even be bringing out phlegms, very thick mucus from your throat that is not of the usual color. Maybe it is brown, maybe it has some blood in it. You should not wait till it has become complicated or you have transmitted it to people around you before you go see your healthcare provider. Do not attempt to self-medicate. You should see your healthcare provider, because they are the ones that are trained to diagnose you properly, to know which of these respiratory tract infections you have, which organism is involved, and the right treatment. And of course, that takes me to the treatment, the normal treatments to combat these infectious organisms, the viruses, the fungi involved, the bacteria involved. I don't have to tell you all those names, because that is the job of your healthcare provider. After they have diagnosed you based on your symptoms or based on your test results, they know the right medications to give you. And you may have to use some adjuncts as well, like some pain relievers for your headache, or some decongestant for stuffy noses, and all of that. All in all, you get the right treatment when you see your healthcare provider. And that is it for respiratory tract infections. Now to World Tuberculosis Day. I've let you know that tuberculosis is one of the respiratory tract infections. It is in fact a lower respiratory tract infection caused by the Mycobacterium tuberculosis. Every March 24th has been set aside to commemorate the World Tuberculosis Day, also known as World TB Day. It commemorates the date in 1882 when the scientist Dr. Robert Koch announced his discovery of the causative organism of this disease, which is the Mycobacterium tuberculosis, the bacteria that causes TB. And the day is to educate the public about the impact of TB around the world, which is what I am doing today. So a few key facts about TB. A total of 1.25 million people died of TB in 2023. This includes 161,000 people living with HIV. I've told you that being immunocompromised is a risk factor for respiratory tract infections, especially tuberculosis. Worldwide, tuberculosis has probably returned to being the world's leading cause of death from a single infectious agent, which is that Mycobacterium, following 3 years in which it was replaced by COVID-19. In 2023 alone, An estimated 10.8 million people fell ill with TB worldwide, including 6 million men, 3.6 million women, and 1.3 million children. TB is present in all countries and all age groups. The good news is that it is curable and preventable. Now, the multi-drug resistant TB remains a public health crisis and a health security threat. Only about 2 in 5 people with drug resistant TB were able to access treatment in 2023. And so far, global efforts to combat TB have saved an estimated 79 million lives since the year 2000. And a lot of money has been committed to this. So, ending the TB pandemic by 2030 is among the health targets of the United Nations Sustainable Development Goals. And that is why I'm telling you about it today, so that you can be careful, so that you can take cognizance of the risk factors, the prevention strategies, and when the symptoms come around, you can quickly go to your healthcare providing centers or facilities, all right, so that you do not infect others and you can get prompt treatment. A lot of people are not aware of what TB is or how it is transmitted. At least now you know that it's a respiratory tract infection and it majorly affects your lungs, okay? When the germs get into the lungs, it spreads and it brings forth symptoms like cough, chest pain, coughing up blood or sputum, fatigue or weakness, loss of appetite, weight loss, chills, fevers, night sweats. But the thing with tuberculosis is that it actually occurs in 3 stages, or it can manifest as 3 infections, okay? It can be a primary infection in which the germ, of course, gets into the lungs, but the immune system tries its best to overpower it. It actually moves off some of these germs, but a few of the germs actually are not overpowered. So it results in flu-like symptoms like just your cold, your cough, and chest pain. That's all. But it can progress to what we call latent TB. This is the one that does not have any symptom, okay? Because the immune system has actually overpowered the germs, prevented them from spreading, but the germs are still there in the lungs, but they do not cause any symptom to manifest. They can be there for as long as years without this person having any symptom of tuberculosis. Or it could go straight from being a primary infection to an active TB infection, in which the immune system is not able to overpower the germs grow and spread throughout the lungs, and even if care is not taken, to other parts of the body, in which we have another type of TB infection called the extrapulmonary TB. This can get to other organs like the kidneys, the liver, the cerebrospinal fluid, that is the fluid that surrounds the brain and spinal cord. It can get to the lymph nodes, it can get to the bladder, and all other organs in the body. Okay, that is why the extrapulmonary TB is usually more complicated and it takes a longer time to actually cure it than the normal or active TB infection. I've told you the symptoms of this TB infections, all right? Now, to the management, there are medications that are used, to manage the TB infections. They are usually a regimen or combination of 3 to 4 or 5 medications, so that they can holistically take care of this Mycobacterium tuberculosis. And the period of treatment can last between 6 to 9 months. The TB medications are usually given on directly observed therapy. That is, the patient keeps coming back to get a refill so that the progress of treatment can be monitored. Okay, and because TB is actually a disease of interest globally, there are some worldwide facts about TB which I'll be telling you, as this year's theme is Yes, We Can End TB. Commit, invest, deliver. That is the theme of World TB Day 2025. And this offers an opportunity to reflect on the ongoing efforts and to encourage stronger commitment at all levels, both local, national, and international, in combating TB and ending it, especially with the growing threat of drug-resistant organisms. You know, I've talked a lot on this podcast about drug resistance, how bacteria are evolving and they're resisting the available medications to combat them. And I've told you that TB medications are a combination of antibacterial molecules or drugs. So this theme calls for stronger commitment to helping eradicate TB by 2030. That is the goal of the World Health Organization. And if we do not come together to commit to ending the disease, to invest in it by sharing the information, that is your cue to share this podcast to your friends and family after listening, to commit to taking care of your health so that you can protect others around you and to deliver this mandate of ending TB by 2030. You know, when this mandate or this commitment was made years ago, maybe in the year 2010 or 2015, we'll be thinking that 2030 is still far away. I mean, it's decades away. But now 2030 is in just 5 years. And according to statistics, TB affects over 1/4 of the world population. That is, if we have 8 billion people in the world, TB affects at least 2 billion people. That is a lot. And in 2023, over 170,000 new episodes of TB were reported. And global number of multi-drug resistant TB cases is about 21%. And that is more than a third of the free extensively drug resistant TB, which is 37%. Prevention, like I always say, is better than cure. So watch out for these symptoms that I've mentioned. If you have people that are immunocompromised around you, you know that you should even take better care. You should not self-medicate. And once you see an inkling of the symptom, you should quickly run to your healthcare provider. That is what I have for you today. Let us all work together to end TB by 2030. Even if we cannot end it totally, let us put a dent on these statistics that I have read out. Let us try as much as possible to reduce it to the barest minimum. Let us together commit, invest to deliver the end to TB by 2030. And that is what I have for you on today's episode of the Anti-Pharmacist podcast. I hope you've learned a thing or two. Well, I am sure that you have, except you want to lie. And I know that I don't have liars as listeners. So this is your cue to share this episode to whoever needs to hear it. If you have a smoker around you that have refused to listen, share to them. It is very important. Okay? If you have somebody that takes alcohol, it will deal with their immune system. Please share. Just share to people around you, your friends, your family, people in the same WhatsApp group as you, and all of that. Do not forget to like, to subscribe, to follow this podcast. As I always advocate, please do that for me. Why I say this all the time is so that we can get more visibility. The more subscriptions, the more visibility, the more suggestions to new listeners, okay? Everybody needs to hear this information that I share on this podcast. Also, you can contact me via mail at anti-pharmacistpodcast@gmail.com. You can leave your comments, your questions, whatever it is you need clarification with, whatever it is I said that you do not agree with, that is your avenue to pour it out to me, guys. I will reply you. Follow me on social media, on IG, on X, on Instagram, on TikTok. I'm there as Anti-Pharmacist Podcast. Why for X? It is Fan Podcaster. And I'm on LinkedIn, guys. Let's be professional together, okay? Follow me on LinkedIn. Add me to your network. I'm Bimsala Adebisi just on LinkedIn. And for collaborations, please, I'm open for collaborations, guys. Message me via DMs, via LinkedIn, or via my mail. Let us work together, okay? Thank you so much for your support so far and for listening up to this point. I'll catch you next time. Till then, stay healthy and God bless you. Ciao.